everyone. Today I want to give a short presentation on how to study anatomy. Now, the human body is a very complex structure, and so studying its intricacies can be very challenging. And so today we'll look at effective strategies and practical approaches that can help you study anatomy effectively. Okay, so whether you're a medical student, you're an allied health student, or a student nurse, if you are struggling with anatomy or you think that your anatomy is on life support, I believe this presentation will be very, very helpful for you. So this is going to be our guide. We'll look at an overview of anatomy. We'll look at the challenges with studying anatomy, and then we'll look at the do's and don'ts of studying anatomy, and then we'll look at some practical steps to take. Okay, so overview of anatomy. What is anatomy? Anatomy is from a Greek word which is anatomy, which means that cutting up. Okay, so it is the study of the structure of body parts and their relationships to one another. Now, there are subdivisions of anatomy. You can have gross anatomy, you can have microscopic anatomy that deals with histology and cytology, and then you can have developmental anatomy or embryology. Now, for the challenges, you see, there's a general principle in life, and the principle is that before you can defeat your enemy, you must know of necessity who or what your enemy is. So if you want to do well in anatomy as a student, you need to understand the challenges that you are likely to face. Now, studying anatomy can pose several challenges, often requiring students to navigate complex structures and intricate details. Now, one of such difficulties or hurdles you are likely to meet is a sheer volume of information. And not only that, you have limited time to consume this volume of information. There's simply information overload, and this is because the human body comprises numerous interconnected systems, organs, and then tissues. Okay, and so there's information overload from gross anatomy, as even the name suggests, is very, very extensive, very gross, to studying histology and then also studying embryology. Now, another challenge you are likely to face is memorizing extensive content, and believe you me, this can be very, very, very overwhelming, and because of that, sometimes it can be very difficult retaining and then recalling specifics. Another challenge is inadequate guidance on how to study anatomy, for which reason we are doing this video. Okay, because if you don't have proper guidance on how to study anatomy, it can significantly impede your learning experience. See, anatomy is a very complex subject that requires multifaceted approach, and that involves various study techniques and resources. Okay, another challenge you are likely to also face, especially when you go to the DR, the dissection room, is that sometimes when you see structures in the textbook, okay, and you come to the dissection room, it looks completely a bit slightly different, and so it's difficult to appreciate what you read in the textbook and then what you are seeing on a cadaver. So I'll give you an example. For instance, the brachial plexus, when you see it nicely drawn in the textbook, and then you do your dissection and you notice that the brachial plexus is not as easy as it seemed in the book. Now, these challenges can be corroborated by research that was done in Uganda, Kampala. The title of the research was Perceptions and Challenges Faced by Undergraduate Medical Students in Studying Anatomy. Okay, and amongst the challenges, the commonest ones that were indicated were limited time for revision before their mid-semester and end of year examination. Also, they complained of information overload and also a lack of suitable equipment and poor internet connection for accessing online resources. Now, you need to know yourself. You need to know yourself. I cannot overemphasize this. This is because we are all not the same. We have unique intellectual differences. We have different IQs, and so you should know what works best for you. There are people who are visual learners. Okay, you need to know your learning style. Some people are visual learners. They prefer to learn through images, charts, and also diagram. And I'm one of such. I learn very well when I see pictures. I hardly forget. There are others who are auditory learners. Okay, they learn best through listening, such as lectures, discussions, or even recorded material. We have people like that. Then we have another group of learners called the kinesthetic learners or tactile learners. Okay, they thrive very well when they have hands-on experience, movement, and also physical activity. So if you want to explain an anatomical concept using physical activity, it sticks better. For instance, if you want to tell them about root values of, let's say, biceps reflex, triceps reflex, brachioradialis, and you use an activity, they are able to remember it more than listening to you describe it. Now, another point you should know is that you should recognize optimal study environment. There are people who can study in a very quiet environment. I, for one, I prefer to study in a very quiet environment. I don't like a place where you have a lot of people around, because sometimes when I study, I talk to myself, and so I like very quiet environment. There are others who can also study in a very noisy environment. In fact, I had some colleagues who can study whilst listening to music, and I cannot do that. I cannot concentrate reading my books whilst listening to music. So if you are that kind of person who can learn in a noisy environment, that's fine. If you think that you need a quiet environment to study, you need to find a place that is quiet. Or if you're someone who can adjust to both, that's also fine. You need to establish a routine. You need to have a time of the day. Know which time of the day that you are able to learn effectively. So if is it during the day or at dawn? Okay. Then consistency is very key. Consistency is very key. Now, when I say consistency, what do I mean? Consistency is a fundamental principle for effective learning. Now, being consistent with studies refers to maintaining a regular and steady approach to learning over time. And you see, this usually involves establishing a learning routine, dedicating a consistent amount of time to study each day or each week, and adhering to a particular schedule that you yourself you've drawn. Now, know your distractions. Things that will distract you, you need to know them. And I've noticed that most of us as students, what usually distracts us is social media, Twitter, Facebook, WhatsApp. Now they say we have TikTok. All these things are distractors. So if you don't take care, it's going to distract you, and you are going to be very miserable at the end of the semester, just like these two red blood cells who met and fell in love, but alas, it was all in vain. Now there are some do's and don'ts of studying anatomy. Do's and don'ts of studying anatomy. Now the do's: please always attend teaching sessions. Do not miss class. Always attend teaching sessions. Don't think that you can stay in your room and then study. You can stay in your room and read the slides afterwards, or stay in your room and read your Ketmore, or look at your Frank Netta. You see, there are times when the lecturer will say things in class that may not appear on the slide, and if you are not there, you will not be able to document that. Also, if you feel like you are easily distracted, you need to sit in front so that you can focus on the teacher. Also, be attentive in class. Know your distractors. Be attentive in class. Pay attention. It's very important. You need to pay attention. You need to focus on the lecturer, because there are certain things that he might say. If you don't pay attention, you will not hear them. And you need to ask questions in class. Don't be a passive learner. You need to ask, be active. And I understand that there are some people who are very shy, and sometimes they are shy because of the size of the class. When there are many, they are unable to ask questions. So if you are in that category, then it means that sometimes you have to send questions to your lecturer or your professor via mail, or maybe after class you can see the lecturer privately and then ask your questions. Now, some don'ts: you do not have to skip lectures. Don't skip lectures. It doesn't help. Never skip lectures. Don't be a passive learner. Never ever be a passive learner. There are people who like dodging questions. They don't like asking questions in class. When they ask them a question, they don't make an attempt to answer. Never be a passive learner. You need to be actively involved. If you are in a group, having a group discussion, try and also answer a question. Try and contribute to the group. Try and contribute to the discussion. Now, one principle you must learn as a student, and this cuts across all discipline, whether anatomy, pathology, and biology, whatever. There's one principle that cuts across. You have to be humble. You need to be humble. Be humble enough to admit that your colleague is better than you. Be humble enough to admit that you don't understand this concept. Don't be proud. Don't feel too shy to ask for help. Be humble and ask your friend to help you. All right. Now, practical steps to take. Now, it's important to note that all good study techniques starts with good note taking. If you know how to take very good notes, it can improve your ability to study more effectively. You can see this point: reading and taking notes. Reading and taking notes. Number one, there are 3 stages. Taking short notes before class. Now, this is very important, and this has really helped me a lot. Taking short notes before class. What do I mean by this? Now, you have the course outline. You know what your lecturer will be treating. So, for instance, if your lecturer will be treating osteology of the upper limb, you need to read about the osteology of the upper limb. You need to learn about the osteology of the upper limb and take short notes. In your reading, in your course of your reading, if you come across anything that you don't understand, you write it down. Never come to class with an empty head. That is disastrous. Never come to class. Never do that. Before you come to class, make sure you've read something small about the topic that is going to be treated and make short notes. Now, the second step is that you take notes during class. As I said earlier on, there are times when the lecturer will say certain things that may not be on the slide. So if you think that you would read the slide afterwards, you might miss those fine details, and those fine details might appear in the MCQs, clinical questions, and you'll be struggling. And you think that, hey, you didn't find these things on the slide, but he said it in class. So you need to take notes. And then also you need to take notes after the class. Write a comprehensive note, how you understood the topic in your own words. Now, another technique you can use is called acronymic sentences. Okay, using an acronymic sentence is a good study method for remembering things that needs to be learned in a specific order. Sometimes for anatomical knowledge, there are certain things that you need to learn in a particular order. For instance, if you have nuclei arranged from medial to lateral or lateral to medial, or you have cranial nerves arranged in a particular order, sometimes it's very difficult to remembering it in that particular order, and so you need to use an acronym in order to learn that. Now, how do you create an acronym? The first thing is to write each piece of information down that needs to be learned in that order. Now, you underline the first letter of each word. Write a sentence using the words that begins with the underlined letter. So I'll explain that. I'll give you an example. So this is the first example, the brachial plexus. You know the brachial plexus, we have the roots, we have the trunk, we have the divisions, we have the cords, and we have the branches, and it's in a particular order. Okay, so the first rule is that you take this word, which is roots, and write down the first letter of the word. So the first letter of the word is R, so you have R here. Then you come to the second word. The second word is trunk. Now the first letter of trunk is T, so you have T here. Then you come to divisions. The first letter of divisions is D, so you have D here. And then you come to chords. The first letter is C, you have C here. Then you come to branches. The first letter is B, you have B here. So now what do? You have these letters. Now you want to form words with these letters that would make sense. Okay, so the first letter is R. Which word was formed from R? Remember. Starts with R. Then the other letter is T. Which word was formed from T? To. They use to. And then D. They use the word drink to form D. And then the next letter was C. They use the word cold. And then B. They use the word beer. So remember to drink cold beer. So once you say this sentence, remember to drink cold beer, you know that for each letter it stands for, R stands for roots, T stands for trunk, D stands for divisions, C stands for chords, and then B stands for branches. It's a very easy way of recalling specifics and things that have been arranged in a particular order. Another example is the cranial nerves. Cranial nerves. You need to know the 12 cranial nerves and in that particular order. And sometimes the cranial nerves, you know that some of the cranial nerves have motor components, others have sensory components, others have mixed component, that is both sensory and then motor. And it's very difficult remembering all these fine details because the nerves are 12. So sometimes it's difficult to remember all. Okay, so this is what they use. Some say marry money, but my big brother says big brain matters most. Okay, so another example is cerebellum nuclei. Okay, so nuclei from lateral to medial. Okay, don't eat greasy food. That is the acronym that they've used. Don't eat greasy foods. Okay, so when you check, D stands for dentate nuclei, E stands for embelliform nuclei, G stands for globus nuclei, and then F stands for fastigial. Now, using another technique called the image name technique. The image name technique. Now, this method is very easy and short, and is used for remembering people or places. Okay, so for this method, for instance, this is the clavicle. When you pick the clavicle, just look at the clavicle and you notice that it has a particular shape, and this particular shape is in the form of like an S form of shape. Okay, so you register this in your mind that anytime you pick a bone, a particular bone that has this kind of S shape, then it's likely to be the clavicle. And this is very, very helpful because sometimes when you go for Viva, they can give you a bone to talk about, or they can ask you to pick a bone. So once you can have this relationships in your head, this image name technique in your head is very helpful. So once you see that the bone looks like an S shape, then you say it's likely to be the clavicle. Another bone here that looks like a bat, you will agree with me that this bone looks like a bat. These are the wings of the sphenoid. This is the lesser wing of the sphenoid, this is the greater wing of the sphenoid. Okay, it's found within the middle cranial fossa. Okay, that looks like a bat. So once you see this, your brain can tell you that, oh, you related this to a bat, and this is the wings of the sphenoid. So it helps you in remembering these things. Now, another step you need to take is getting a study group. Very, very, very crucial. Getting a study group. Now, you need to get to know your classmates well before asking them to join your study group. Okay? You need to ask questions like, is this classmate of mine motivated to learn? Does this classmate of mine understand the subject well? Is this classmate of mine dependable? Okay, will this classmate of mine be very tolerant of other people's ideas? You need to ask yourself those questions. Then also, when you are inviting people to join your study group, you need to invite the correct number of classmates to your study group. At best, 3 to 5 people in the study group is okay. If you have more than 8, 10, no, it's not effective. So 3 to 5 people in the study group, very important. Now you decide how often you guys are going to meet and how long the sessions will take. So you can meet maybe twice or thrice a week and for each session you can meet maybe 30 minutes or 1 hour 30 minutes. You also have to decide where you guys are going to meet and choose a location where there are no distractions, and also decide the goals of the group. So you decide if, okay, today when we meet we are solving past questions or we are going over what our lecturer taught. You need to decide the goals of the group so that when you come you have a focus. You also need to decide on a group leader, or you decide that you have a leader every week. Okay, now there are times where you would also have to talk to senior colleagues about your challenges and ask them how they were able to navigate through, how they were able to pass the course. Now I want to take you through some of the resources to use. Very, very good resources to use. Now you can use flashcards. You see, it has pictures of anatomical structures. Some of them have quizzes indicating which parts. But the issue is that sometimes it can be a bit expensive for people, and so a cheaper one that you can use is a sticker. Okay, you can write some key points on the sticker. You can paste it on your wall, you can paste it on your fridge, you can paste it on your cupboard, wherever. Okay, sometimes you can paste, this cranial nerves is very, very difficult to recall. There are times where this knee jerk reflex, brachial reflex, brachioradialis reflex, and their root values is a bit confusing. So you can write all these things down. When you wake up in the morning, you can just have a look at it. When you're going to bed, you can just have a look at it. So these are very great resources that I personally used. Stickers. Now for the reading material, I use Kesmo. Kesmo is a very, 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 very good book. Very, very, very good book. Kesmo is a very good book. It explains things in details, the anatomical structures in details, and after every topic, it gives a set of questions with clinical correlations. It's a very, very good book. Kesmo, that's what I used. And also for the atlas, use Frank Netter. I know a lot of people use Frank Netter. Very, very good read. Now, you should not study anatomy in isolation. That is very dangerous. Never study anatomy in isolation. The only way you can assess yourself and know that you really understand a topic is by solving questions. You need to solve past questions. You need to solve questions. So one material you can use is examination questions and answers in basic anatomy and physiology. Okay, 2000 MCQs. So that's a bank of questions. You can use that. You can also use one of my favorite by Lippincott, Anatomy Recall. Very, very good anatomy bank questions. He has so many questions that you can use. And also BRS, Board Review Series, very, very good resource that you can use. Has so many questions, very relevant questions. Now another resource that I would encourage you to use is anatomy in 3D. Sometimes when you study the anatomy, if you are not in the dissection room and you are studying anatomy in your room, sometimes it's good to view structures in 3D. For instance, if you are studying the skull, it's good to look at the inferior part, the superior part, the frontal part, and the lateral part. Okay, so if you have an app that can show you anatomical structures in 3D, it's very, very helpful. And one resource that I used in studying was Anatomy Zone. Shows anatomical structures in 3D. It's very, 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 very important. And so guys, if you've learned a thing or two from this presentation, kindly like, share, and subscribe to my channel. Thank you, and I'll see you in the next video.